difference in the world. In this video we will discuss type 2 diabetes, a condition that affects millions of people worldwide. Inside your body, there's an intricate balance that keeps your blood sugar levels in check. But when that balance goes awry, type 2 diabetes enters the scene. It's like a mischievous villain wreaking havoc on your body's sugar management system. An introduction to type 2 diabetes. Type 2 diabetes is a chronic metabolic disorder that develops over time, often influenced by our lifestyle choices and genetic predisposition. This condition is characterized by insulin resistance, where your body becomes less responsive to the hormone insulin, leading to elevated blood sugar levels. Now, let's talk numbers. Brace yourself for the staggering impact of type 2 diabetes worldwide. Imagine a whopping 463 million adults living with this condition in 2019, as estimated by the International Diabetes Federation. And hold on to your seat, because that number is projected to soar to a mind-boggling 700 million by 2045. That's a global health challenge that demands attention. Type 2 diabetes doesn't discriminate. It affects people from all walks of life. It's a universal concern that requires a united effort to combat its rise and provide support to those affected. So, get ready to embark on a journey where we'll unravel the mysteries of type 2 diabetes, explore prevention strategies, discover management techniques, and learn about the incredible resilience of the human body. Let's get started. Insulin resistance and blood sugar regulation. Insulin is a hormone that helps regulate blood sugar levels by allowing glucose to enter cells for energy. In type 2 diabetes, insulin resistance occurs when cells become less responsive to insulin signals. This leads to elevated blood sugar levels and a higher risk of developing the condition. Factors such as excess weight, inactivity, and unhealthy lifestyle habits contribute to insulin resistance. Understanding this relationship emphasizes the importance of maintaining a healthy lifestyle to improve insulin sensitivity and prevent type 2 diabetes. Causes and risk factors. It's a complex interplay of genetics and lifestyle choices. Insulin resistance lies at the core of type 2 diabetes, where cells become less responsive to insulin signals, leading to elevated blood sugar levels. Genetic factors can influence your predisposition to the condition, but lifestyle choices are key. Obesity, a sedentary lifestyle, family history of diabetes, and ethnicity all play a part. Excess weight and inactivity disrupt insulin function, while a family history increases the risk. Certain ethnic groups have higher susceptibility. By understanding these causes and risk factors, we can make informed choices. Stay tuned as we explore prevention strategies and empower ourselves to make positive lifestyle changes that reduce the likelihood of type 2 diabetes. Symptoms. One of the most noticeable symptoms is increased thirst, also known as polydipsia. You may find yourself feeling unusually thirsty and needing to drink more fluids than usual. Along with increased thirst, frequent urination, or polyuria, is another common symptom. You may find yourself making more trips to the bathroom, especially during the night. Fatigue and general feelings of tiredness can also be indicative of type 2 diabetes. Despite getting enough rest, you may experience persistent fatigue that affects your daily activities. Blurred vision, a result of high blood sugar levels affecting the lens of the eye, is another symptom to be mindful of. It's important to remember that these symptoms may vary from person to person, and some individuals may not experience any symptoms at all. However, if you notice any of these signs, it's crucial to consult a healthcare professional for further evaluation. Diagnosis. To diagnose type 2 diabetes, healthcare providers rely on various diagnostic tests. The most common test is the blood glucose test, which measures the level of glucose in your blood. This can be done through a fasting blood glucose test, random blood glucose test, or an oral glucose tolerance test. These tests help determine if your blood sugar levels are within a normal range or if they indicate diabetes. Another diagnostic tool used is the HbA1c test, which provides an average of your blood sugar levels over the past 3 months. This test measures the percentage of hemoglobin that has glucose attached to it. A higher HbA1c percentage indicates poorer blood sugar control, suggestive of type 2 diabetes. These diagnostic tests, along with a thorough evaluation of your medical history and symptoms, help healthcare professionals make an accurate diagnosis of type 2 diabetes. Early detection allows for prompt intervention and appropriate management to prevent complications. If you experience any symptoms or have concerns about your risk for type 2 diabetes, it's important to consult with a healthcare professional. Regular checkups and screenings can help ensure early detection and effective management of this condition. Things you can do to prevent diabetes. Now that we understand the causes and risk factors of type 2 diabetes, it's time to arm ourselves with strategies to prevent or delay its onset. By adopting healthy habits, we can significantly reduce the risk and pave the way for a healthier future. First and foremost, maintaining a healthy weight is crucial. Excess weight puts strain on the body's insulin function, increasing the risk of developing type 2 diabetes. By striving for a healthy weight range through a balanced diet and regular exercise, we can make a significant impact on our overall health. Regular physical activity is another key component. Engaging in regular exercise helps improve insulin sensitivity, making it easier for glucose to enter cells. Aim for at least 20 to 30 minutes of moderate intensity aerobic activity 5 times per week, such as brisk walking, cycling, or swimming. Making healthy food choices is essential for preventing type 2 diabetes. Opt for a well-rounded diet that includes plenty of vegetables, whole grains, lean proteins, and healthy fats. Limit the consumption of sugary beverages, processed foods, and saturated fats. Remember, small changes can make a big difference in reducing the risk. By adopting these prevention strategies and making positive lifestyle choices, we can significantly reduce the risk of type 2 diabetes. Medical treatment. If lifestyle modifications are not enough to control the blood sugar levels, then medications are required. Your healthcare professional will discuss the most suitable medication for you alongside lifestyle modifications. In some cases, insulin therapy may be necessary to regulate blood sugar effectively. Each medication has its own side effects which may or may not affect you. You may also experience low blood sugar levels or hypos with certain medications, especially higher doses of insulin. That's why regular monitoring of blood sugar levels and routine checkups with healthcare professionals are vital to assess progress, adjust treatment plans, and prevent complications. It is important to work closely with healthcare providers to find the most suitable treatment approach and to ensure optimal management of type 2 diabetes. My next video will be about the natural ways to prevent diabetes, so make sure to subscribe and turn on notifications so you are alerted when it is released. Complications of type 2 diabetes. Long-term complications associated with uncontrolled type 2 diabetes can have a significant impact on overall health. Cardiovascular disease, including heart attacks and strokes, is a common complication. High blood sugar levels can damage blood vessels, leading to atherosclerosis and increasing the risk of heart-related conditions. Nerve damage, known as diabetic neuropathy, can result in pain, numbness, and tingling in the extremities. It can also affect digestion, sexual function, and lead to foot ulcers. Kidney disease, or diabetic nephropathy, can occur when the kidneys are unable to filter waste products effectively. This can progress to kidney failure, requiring dialysis or transplantation. Eye problems, such as diabetic retinopathy, can damage the blood vessels in the retina, leading to vision loss or even blindness. It is crucial to manage and control blood sugar levels effectively to prevent these complications. Regular monitoring, adherence to treatment plans, and lifestyle modifications are essential. You will need regular monitoring. Several different teams may be involved in your care, including doctors, diabetic nurses, dietitians, podiatrists, foot care specialists, and optometrists. You will have regular checkups to make sure any complications of diabetes can be picked up early. These include checking blood tests for HbA1c to monitor your glucose control, also checking your cholesterol and renal function. Urine tests. Ongoing lifestyle and dietary advice including blood pressure checks, regular eye checks and foot checks. Support and resources. Living with type 2 diabetes can be challenging, but support and resources are available. Support networks, such as diabetes support groups or online communities, provide a platform for sharing experiences, receiving encouragement, and obtaining valuable information. Educational resources, including websites, books, and podcasts, offer insights into diabetes management, healthy recipes, and tips for coping with the condition. Diabetes management programs, often offered by healthcare organizations or diabetes associations, provide comprehensive support, including education, counseling, and personalized care plans. Taking advantage of these resources can empower individuals with type 2 diabetes to navigate their journey effectively and maintain optimal health. Conclusion: Type 2 diabetes is a complex condition that requires careful management and attention. By understanding the causes, symptoms, and complications associated with type 2 diabetes, individuals can take proactive steps towards prevention and early intervention. Lifestyle modifications, such as adopting a healthy diet, engaging in regular physical activity, managing stress, and getting sufficient sleep, are key in managing blood sugar levels and reducing the risk of complications. Regular monitoring of blood sugar levels and routine checkups with healthcare professionals are crucial to assess progress and make necessary adjustments to treatment plans. And that's it, guys. I tried to make type 2 diabetes super simple for you. My wish is that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.